Hope springs eternal, and thanks to a program for pregnant women dealing with addiction, there is hope out there. We'll speak with the director of Project Hope for Women and Children next on the Marshall Health Source podcast.
You are listening to the Health Source podcast, presented by the Marshall Health Network. Now here's your host, Rick.
Hello
Lord.
again, and welcome inside the Marshall studios here on the campus of Marshall University, the Health Source podcast brought to you by the Marshall Health Network. And today we're going to be talking about a very important program that's been around for a while that maybe you might not have heard of, that deals with a very specific targeted group, an important group in our society. And with us today to speak about that is the director of Project Hope for Women and Children, Kathleen Maynard. Thank you so much for joining us today. We appreciate your time.
Great. Thanks for having me.
So give us a little bit of insight and background into how you got to where you are and how you got to be the director here of the Hope Project for Women and Children and what it does.
Sure. So if I go back all the way to the beginning,
Sure.
I got my degree here at Marshall, bachelor's and master's in mental health counseling. Then kind of took a journey in our basic community behavioral health center, learning about substance use disorder, where I got both of my certifications in advanced alcohol and drug counseling, as well as a licensed professional counselor. From there, I worked in different settings, criminal justice setting, medication-assisted treatment, residential, outpatient, and that eventually led me to a job as a therapist with Marshall Health's ProAct facility, and then ultimately the opportunity came available to become the director at Project Hope for Women and Children.
I noticed you have a lot of letters after
I
your
do,
name when you
I
have
do.
the title up there.
Yes.
That means you have a very diverse background. As I think about this and the ever-going problem, it's such a complex issue, and it's
Absolutely.
such a deep-seated, fundamental issue. And along with that, how do you go about balancing the physical, the emotional, the psychological, the mental needs of these prenatal or postpartum women that are dealing with addiction?
Sure. So I think that is part of the magic of Project Hope is that we work on all those aspects. The small address there in Huntington, it's just a part of the puzzle that we're serving. We're able to provide mental health and substance use counseling for the women, but we also partner within our agency, Marshall Health, with ProAct to provide that medical care, family medicine to provide primary care, the OBGYNs to provide that important health care for the moms while they're pregnant, as well as spiritual care. ProAct is able to address all of that, and so we try to weave in as many opportunities for that holistic care so the moms and the kids are getting the help they need.
Are there any specific models or philosophies that guide you in what? Everyone's different, obviously, but we've heard of like 12-step programs,
Sure.
trauma-informed care. Is there anything that helps guide the way that you do what you do?
All of those. So 12-step programs, they tend to lead the way. Originally, founded many, many years ago, they laid a good foundation for what we're doing. And then we have medication-assisted treatment, which is able to support, and that's a medical model. We use cognitive behavioral therapy as a more therapeutic model that a lot of the therapy is based out of. Everything we do is trauma-informed care at this point. So we approach every patient, every situation with that mindset of trauma-informed care.
And there's such a stigma involved.
Absolutely.
In this. So how do you fight through that?
So pregnant and parenting women tend to be the most stigmatized within that substance use population because the community believes, well, because you're pregnant, you should want to stop using. And it's not that the moms don't want to stop. It is, are they physically able? Can they stop? Can they get through some of those big barriers in order to support that? So they are very stigmatized. And I think a big one is education. An opportunity like this today, educating the public about what we do and the population we serve. Also, just different community events, reading about our program, getting our program out in the community and meeting our moms when they have jobs in local hospitals and daycares and a variety of things, and just doing recovery and learning that there is another story to that.
So what type of partnerships are in place with various like OBGYNs or pharmacists or social services?
Sure.
As part of, the Marshall Health Network is a vast network. So what kind of partnerships have you guys been able to form and sustain throughout this network that has helped you do your job?
Sure. So we always support consumer choice. They can go for these different services where they want to, but a lot of them find it much easier to work within the network because our medical director is able to, communicate amongst different physicians and providers the needs of the mom or the needs of the children much more fluently just because we are within one network. So we work with PROACT, which is within Marshall Health's Division of Addiction Science, where outpatient medication-assisted treatment and psychiatric care tends to happen. We work with the pediatric office. We work with family med. So those are all kind of in-house things that we do. Anything within Marshall Health Network we're going to work with easily. But then we also work outside of our network, whether it is Dress for Success to ensure our moms have the perfect clothing to go back into work or something just to feel comfortable when they have to go to court. The Huntington City Mission provides our moms breakfast, lunch, and dinner if they don't have their food stamp cards, things like that yet. So those are just a small few of our partnerships. But we have lots of them. Walmart is another one that they just celebrated Fun in the Sun, where they brought all kinds of activities for our kids to do, a bounce house, balloons, bubbles, all of that, just to enjoy a summer day as they kicked off summer.
Then, going back to kind of what we were talking about with the stigma, what you mentioned just kind of ties along with that, because a big part of it is the relationships and the trust that you can build with these women and building back their self-confidence.
Yes.
How challenging is that?
We start that from day one. From the moment that a mom calls, we promise that we're going to return their call. We try to give realistic expectations in getting into our program, and that builds that confidence that there's help. And then as soon as the moms come in, I stress to my team that we're going to do what we say we're going to do, so follow up on that. So every time if a mom asks for another towel and we're able to provide them a towel, or they need shampoo, or they need something, we're able to fill that need, they begin to trust us. Then we get into the bigger stuff like labor and delivery or court advocacy and things like that, where we're sitting right next to them and able to advocate for them. It just continues to build that trust so that when they are meeting other community members, family members, friends, and are learning how to regain trust, we role model that, right? We model it for our moms so that they're able to do that with others.
And addiction recovery is such a process.
It is.
And it's a lifelong process. And there are always roadblocks and obstacles and sometimes setbacks as well. And when you have that trust built, how do you balance that with the legality of this, where there are sometimes where there are mandatory reporting laws when things are happening there? So how do you balance that?
Honesty is the best policy.
Yeah.
I think in a lot of the situations we've come across is I am very upfront with them when they first come in. These are kind of my guardrails that we have to follow, and if we cross those, I have to do certain things.
These are the deal breakers.
Yeah, these are the deal breakers. This is what I have to do. And so because I'm able to be honest with them when those things come about, I am able to report that, and there's a lot more understanding, again, because that trust we're building. And so they understand that give and take, but they also understand that there's lines that we can't cross.
Yeah. And what you see a lot in treatment in a vast variety of fields nowadays is, as we learn more and we understand that different things affect different people in different ways, that there's a cultural aspect to this as well. So, I mean, have you been able to ensure like culturally competent care for different demographics?
Absolutely.
How does that work?
Yeah. So, Project Hope has served all 55 counties since we've opened. Even our surrounding states we have served, and even as of recent an international population. And so we have to do some deep dive research sometimes, but also I think for our outsiders is understanding that we're Appalachia, and that itself is its own culture.
Right.
And so when we're talking to programs in California or in Florida or other states, and they share their programs and how things may be different in our area, is just because of our culture and how things are more challenging. But education, being aware of it. If there's a religion or a practice that we're not aware of, my staff is really good to research and understand and ask questions. Help me understand.
That's right.
Yeah.
And it's one of those things where it takes a village, right? So,
Yeah, absolutely.
And I'm sure, sometimes what might work for some person might not work for someone else.
Absolutely.
And maybe Project Hope might not work for everyone, but there might be something else out there for them. So are you able to provide various resources and diverse resources for these people and to just basically let them know that there are other support systems in place for them and what those might be?
Yeah. So, to date, I think we've had over 270 families walk through the door at Project Hope. Project Hope hasn't completed 270 graduates, so we are not it for everyone, but we can proudly say that no one leaves leaves our program without a referral, a warm handoff, or even what I like to call a hot handoff, where I'm going to take you with me to another program to ensure that they are getting that next step. And so we are able to provide that wraparound care. So if we're not their cup of tea, we're able to find another program that may meet their needs.
And for these women, I assume that, and I don't want to make assumptions, but it would go to the reason that a big concern for them, especially if they have children, which we're dealing with, pregnant and postpartum women, is maintaining custody of their children through all of this. Do you work with them on that aspect?
Yes. So I think if we talk about what Project Hope's special sauce is, or what makes us unique, is that we advocate. We believe that a mother is going to do the best in her recovery if she has her children. We also know statistically that child care is one of the biggest barriers a woman in recovery has to face in order to get the needs that they need met. And so we advocate right alongside. We go to court. So our goal is an improvement in their parenting plan. And so whether that is they are getting visitation now and they weren't when they entered our program, or they have overnight visits now and they weren't, all the way to full custody with a closed case, which we just celebrated that earlier this morning.
Yeah, and not to throw shade on legislators or anything, but I mean, I think it's pretty well agreed upon that the foster care system in the state is kind of in shambles. That the DHS has some issues. Do you closely monitor any of that to make sure that that you can maybe help out in any way that you can? I know you don't want to get too much into the legalese of it all, but sometimes the two work hand in hand, and you have to be aware of what's going on.
Absolutely.
As well.
Advocacy, for my position as the director, advocacy looks and takes on a lot of different roles. One of them is in that courtroom or a medical appointment advocacy with the mom, but the other part of it is within legislature, either state or federal level, and advocating at that level is not something new to me, and so ensuring that some of these legislation changes, that they understand the negative or positive impacts they're going to have on the treatment facilities around here. And so we do a lot of that. Participating in Recovery Advocacy Day, having our team talk to our legislators is always very important.
And it's tough to keep track of because things are changing by the minute, and sometimes they completely break up the DHHR. Now it's three separate. There's a whole new world that you have to live in. So talk a little bit about what's going on this weekend, because I know that there's an event happening for Project Hope, and hopefully people watching this that might not have been up to speed on what you do and how to get some people out there and get some support behind it.
Yeah, so Hope Blooms, a fashionable family brunch. This is our second annual family brunch, and it is a time to celebrate all of our women and the work that's done at Project Hope. And so we have different local clothing vendors that are setting up a pop-up shop for people to shop, and then we have a wonderful brunch that's supported by recovery-friendly food vendors in town, and then we also have a fashion show to wrap it all up.
And that's on the 14th?
That's on the 14th, yes, here in Huntington.
What's the easiest way to people to get more information on it? Is there a website set up? Or?
So our financial support for fundraising comes through Marshall Health Network Foundations, and if you Google that, you'll find their website, and Hope Blooms, you can find more information there.
What's the feedback been so far in general? I know that, and maybe I should phrase this differently. First of all, in your view, what's a successful outcome?
So it's kind of like playing baseball. In baseball, you have a single, double, triple, home run, grand slam if we hit it. A single is going to be just getting a mom into treatment, even if she's just there for a few days and decides to leave. Establishing that care, getting them to understand that there's people in the community that care, that can be a single. All the way to a home run is going to be where a mom delivers a baby safely, not under the influence of illicit substances, graduates our program with safe housing, transportation, and gainful employment in the community. We'd consider that a grand slam for us, but any of those things are successes to us.
And I would imagine that you view your project and the people that work with you as more like facilitators in a way. So what are some of the common barriers to access this type of care or to go through this type of treatment that these women are often facing?
Yeah, so I mentioned childcare. That tends to be a big one. Stigma is another barrier. What are people going to think of me? Or I don't have any help. My family will, may think I have a much more bigger problem than I really do if I need a facility like that. Insurance can be a big one. Yeah. Some of our women come to us and they haven't yet established their Medicaid, and so we have to go through those steps. And so that still today, people don't realize that Medicaid can be so accessible right now. And so That can be another big barrier. That time commitment, when we were looking at 6 months, can be quite overwhelming for some people. And so they're not yet ready to commit to that. And so we have to look for other avenues of treatment for them.
Yeah, and as we mentioned, very, very complex. And we began by talking about, how deep this goes and how this has been around for so long. Are there any recent innovations or pilot programs that you've come across? I know the Project Hope has been around for a little while here, but has anything happened recently that has you excited about, hey, maybe there is this light at the end of the tunnel?
Yeah, I think that's one of the amazing things for me working at Marshall Health and being associated with the medical school is that we're able to engage in a variety of different research projects. And so with the medical school and Dr. Zach Hansen and Dr. Todd Davies, we're able to do a lot of different research, which just excites me because we're not just working on a problem, but we are trying to find solutions. And while we may not find the solution, we're finding lots of small solutions that are going to help add to them. So even just changes in medication styles or knowing what we're looking for as the substances out there continue to change, we're able to kind of be one step ahead of those models and know what's coming. We were just involved in one certain type of research for pregnant women, and it was able to use an injectable medication so that they didn't have to take something every day, and that was able to be more effective for the children, for the babies being born. And so, I'm just excited that Marshall Health and Project Hope, we get to work together in order to find solutions for this.
Yeah, and education is so important, not only for the user, the people that are going through the addiction, but also for the general public who sometimes, going back to the stigma thing, looks at these people as criminals.
Yes.
And not humans
Yes.
that are dealing with something. So I'm sure that's part of what you guys do is just work hand in hand with all these people and probably stay in touch with many of them too after they go through the program. They probably become lifelong friends some of the time.
Yeah, that's one of the biggest blessings, I think, is I get to employ some of our graduates after they've been gone for a period of time.
Let them give back.
Yes, so we have a position called a peer recovery support specialist, which is an individual in long-term recovery that has 2 years that has gone through a testing and certification process that says that what they do is good work and that they are able to share their lived experience with another individual. And so we do have a few individuals that are on our team that are in long-term recovery, and some of them have been graduates of our program.
That's got to be neat to see something like that.
It is. And I always tell them, I'm like, if you think you're going to get one over me, try getting it over this staff. And then if you can get it over her head, then that was a good one.
And then down the road, you'll be having the same conversation
Yes.
with somebody else that you've helped along the way. Well, that's fantastic. Well, if someone who's watching or listening right now might be dealing with this or might think that they're getting in a dark place, what kind of advice would you have for them to try to at least give them that nudge to get on the road to
I would hang on, reach out for help. There's so many opportunities around Huntington now. 15, 20 years ago, we had less than, I think, 50 treatment beds in Cabell County, and there wasn't a lot of resources, and what we did was very limited. So now when people are offering help, take it. And then just keep hanging on, because there's going to be someone come right along behind the next person and ask, how can I help you? And when they do, be open to listen to the opportunities that are out there, because we are getting more innovative and more resourceful with what we're able to do and where we're able to answer these calls to help individuals. So, I always just encourage people to keep hanging on. We're here to help.
All right. Well, we put the website when we were talking about. We put the address on the screen, so hopefully people can get involved and maybe come out this weekend and help support the cause. And if you're listening right now on Spotify, be sure to like us and subscribe so that you'll know whenever a new episode comes down the pike. And we want to thank you for your time today. Such informative stuff, such an important issue. So
yes, great.
Thank you for coming in and helping educate and inform people on what you're doing. And best of luck moving forward.
Great. Thank you so much.
Katie Maynard, we appreciate your time, and thank you for helping support the Health Source podcast brought to you by the Marshall Health Network. I'm Rick Lord. Until next time, take care.
That was the Health Source podcast, presented by the Marshall Health Network.